Great. Thank you. Well, welcome and thanks for attending today. For those of you, well, for everybody, my name is Dave Brown and I work for TrueLink Medicare Advisors. We are owned by the Minnesota Credit Union Network, which is the trade association for all the credit unions in Minnesota. And we've been working with Mayo. I think we're going on our 4th year now of offering services to the Mayo Credit Union for folks who need help with Medicare. In person, if you're in person, you got a booklet like this, and inside there's some information. There's a card that looks like this, and if you fill this out, if you will put your email address on it, you're not required to fill it out, but if you do, if you put your email address on it, I'm going to send you a thank you for attending today, and then just say, do you need help with Medicare? If you don't have to respond. If you do, then we can find time to schedule a time to meet. We can either meet in person or virtually or by phone, whatever you want to do. For those of you who are attending online, you'll receive some attachments this afternoon with similar information. And again, if you want to meet in person, I'm happy to schedule a time to meet at one of the credit union branches here in Rochester. If you're in other states, be happy to schedule a virtual or a phone call. At the end of this presentation, I have a slide with contact information, email address and phone number and all that. So with that, we'll get started. I've been doing Medicare for 18 years now, and I'm happy to help and go through this educational presentation. So the disclosures, just letting you know, this is an educational presentation. We aren't selling anything today. We're not going to talk about any plan specifics, but we will give a general overview of Medicare. If you have questions, you're welcome to ask as we go along. If you're online, if you'll enter those into the chat, we'll try to answer those as we go along. So with that, we'll get started. We are in Minnesota. We sell all the plan options, whether it's Medicare Advantage or Medigap supplement plans, standalone prescription drug plans, and we are licensed in several states to help people who don't live in Minnesota. So the basics of Medicare. Our agenda, we'll talk about why would you want to use TrueLink Medicare Advisors, what is Medicare, what does it cover, what doesn't it cover, the different enrollment periods and deadlines, costs that are associated with Medicare. We'll talk about what if you want to work past the age of 65. Do you need to sign up for Medicare at that point? We'll discuss that, and then we'll take a look at private insurance options. Information overload, so especially probably starting about now through the end of the year, TV ads are going to ramp up for Medicare. It happens every year. And you get celebrities on there asking you to call an 800 number, and you get tons of mail and all that. We're here, we've been vetted by the credit union, so hopefully we'd like you to use us, but if you do choose to call one of those ads or 800 numbers, that's certainly an option for you. You just don't know what you're going to get on the other side. There's never a cost for our services, and I should point out, Mayo, for certain employees, they use a third-party provider called Via Benefits. If you started working for the Mayo Clinic prior to January 1 of 2002, you're most likely going to be eligible for Via Benefits, where you get reimbursement money every year. And if you are in that boat, we can still advise you, but you're going to want to enroll when that time comes through Via Benefits so you don't lose that reimbursement money. It's over $1,700 a year for those who qualify. So again, we're happy to advise and direct you, but if you're started employment prior to that date, your HR is going to let you know that you'll want to go through Via Benefits for that. We are here to educate and help you understand the whys of Medicare. Like I said, we offer multiple companies and plan types. You can have one plan, your spouse can have another plan. It's really what's going to be best for your situation. And then we're available throughout the years for questions and assistance. I get calls every week, unfortunately, from clients saying, I don't think I got billed correctly, or I think they're charging me for something I shouldn't have a copay for. So we do a three-way call with the insurance carrier and help you get that straightened out. And then every year during open enrollment, and that's October and November, we will review your plan if you want us to. You'll get an email. If you're our client, you'll get an email and or a letter from us in August or September. just asking, do you want to review your plan options this year? If you do, we'll schedule a time to do that. The thing that changes most with plans is going to be the prescription drug portion, and your medications can change from year to year if you're taking medications. So we'd like to review that to make sure that whatever plan you have this year is still going to be the right option for you next year, and if it's not, we'll find one that is a better option for you for the next year. Original Medicare, there's two parts to Original Medicare. There's Part A and Part B. Part A is going to provide coverage for hospital, skilled nursing, home health care, and hospice. If you've worked or your spouse has worked in the United States for at least 10 years, you've paid the Medicare tax, you've had that taken out of your paycheck. That's what funds Medicare Part A, so you won't pay a monthly premium for Medicare Part A. Medicare Part B is coverage for doctors and specialists, outpatient surgeries, therapies, durable medical equipment, supplies, ambulance, all those types of things. There is a monthly premium for Medicare Part B. This year that starts at $202.90 a month for most individuals. If you're in the higher income category, you may have a surcharge added onto the amount. We're going to go over that in a little bit. But there is a monthly premium for most people for Medicare Part B. When I started in the Medicare field 18 years ago, the Part B premium was $56 a month. So it's increased substantially over the years. There's things that Medicare, Original Medicare doesn't cover. So Original Medicare is not going to give you any comprehensive coverage for dental cleanings, doesn't offer worldwide coverage, won't give you any coverage for hearing or eyes, eye exams or eyewear, and it doesn't cover fitness benefits or outpatient prescription drugs. So the plans, the supplemental type of plan that we'll go over, they will give you some sort of coverage for these areas, but Original Medicare doesn't cover these things. Also, if you just had Original Medicare Part A and B, there's no what's called maximum out-of-pocket protection. Most people choose to add on supplemental coverage, but if you just go with Medicare Part A and B, you're going to have a deductible for the hospital of over $1,700, whether you're there 1 day or 10 days. Part B, you'd have a deductible of $283, and then you're going to pay 20% of whatever your costs are for whatever your medical issues you're going through if you just have Original Medicare A and B. So if you have costs of $200,000 and you chose to just go A and B, you're going to pay 20% of that. So most people don't want to be in that situation. So supplemental coverage helps give financial protection in those areas too. So the private health insurance options, there's what's called the supplement plans, or also known as Medigap plans. We'll talk about those. There's Medicare Part C, you've probably heard about. Those are Medicare Advantage plans, or in some areas of Minnesota, Medicare cost plans. And then Medicare Part D is the prescription drug coverage. So with the Medigap plans or supplement plans, in most of the country they're going to be called Plan F, Plan G, Plan N, L, K. We don't call them that in Minnesota. They're going to be called a basic plan, extended basic. Some carriers offer a copay plan, some offer a high deductible plan. With Medigap plans, your benefits do not change from year to year. The premiums tend to go up every year, but your benefits don't change. The benefits you have this year are going to be the benefits you have next year. There's no networks in the Medigap plans, so any provider in the country who accepts Medicare will accept your Medigap plan. It travels with you when you leave the state. Most of them are going to give you coverage if you're traveling foreign. Some of them, I should say, will give you coverage for foreign travel, some won't. And if you relocate or move to another state, you won't lose the Medigap plan you have in Minnesota. The downside to that is Minnesota and New York have the highest priced Medigap plans in the country. So if you moved across the border to Wisconsin or to Iowa, you're going to pay about 40% less for the same coverage, same plan that what you're paying in Minnesota. But if you were to move, you don't lose your coverage. So if you wanted to switch to a Medigap plan, if you move to another state, you're going to be asked health questions. And if you answer yes to the health questions, they'll deny you, so you'd keep the Medigap plan, or you always have the option of going Medicare Advantage if you start out with Medigap. If you don't join a Medigap plan when you're first eligible, down the road, if you want, say you start out with an Advantage plan and want to move to Medigap plan, you're going to be asked health questions. And if you answer yes to any of the health questions, then you'll be denied coverage for a Medigap plan. With Medigap, it's just medical coverage. It's more a la carte. It doesn't include prescription drug coverage, and it doesn't include dental or vision coverage. So if you go Medigap, you would need to buy a policy if you want dental coverage, and if you want coverage for your eye doctor and eyewear and that, you'd need to buy a policy for that. Medigap plans will not pay for your annual eye exam. Medicare also will no longer pay for an annual physical if you go Medigap. Medicare Advantage plans still pay for annual physicals. Medigap plans will not pay for an annual physical because original Medicare no longer does. They'll pay for an annual wellness check, which doesn't amount to a whole lot, but they don't pay for annual physicals anymore. Contrast that with Part C Medicare Advantage or Medicare cost plans. With these, everything's rolled together. So you have your medical, prescription drug, dental, vision, and hearing benefits, free gym membership, all that's rolled together for one monthly premium. The providers do have a network of doctors you can use, but companies like Blue Cross and Medica in Minnesota, 97% of providers are in their network, including the Mayo Clinic. Just throwing out the Mayo Clinics in Florida and Arizona do not accept Medicare Advantage plans. Rochester does, and they accept plans from Blue Cross and Medica. They don't from United Healthcare anymore, or Humana, or some of those others. United Healthcare Advantage plans, they do accept Medigap plans. There's only those two providers in Rochester that will accept for Advantage plans. You do not need to see a referral, or you don't need a referral to see a specialist on Advantage plans if they're what's called a PPO plan. There's a few companies that still offer HMO plans. You're really limiting the flexibility you have if you choose to go with an HMO plan, and if you travel, you're going to have limited coverage. If you go with an Advantage plan that's what's called a PPO plan, they have national networks, so if you're traveling across the country, you'd still have a network, but like for instance Blue Cross, you'd be a part of the National Blue Cross network. You could see any provider that's in the National Blue Cross network while you're traveling. So you have much more flexibility with that. And your monthly premiums are going to be considerably less on Advantage plans than they would be if you went with a Medigap and added on all the extras. We'll talk about that a little bit. There are certain enrollment periods for Medicare Advantage plans, and the benefits can change from year to year, and the premiums can change from year to year. Any questions on that so far? Yes?
What were the two you said Mayo accepts?
Blue Cross and Medica Advantage plans, yeah. They accept all the Medigap supplement plans, yeah. And then if you go Medigap supplement and want prescription drug coverage, you would want to add on a standalone prescription drug plan, also known as Part D. Each insurance carrier has a formulary, which is a list of prescriptions that they cover. And if you meet with us, we're going to ask you to bring a list of any prescription medications you're taking. We will look those up and help you find a plan that hopefully covers all of your medications. There's usually at least one plan out there that's going to cover all your medications, but we look that up for you so that you aren't shocked when you go to the pharmacy and find out you have a medication that's not covered. Every company offers mail order service, and then every insurance carrier is going to have different tiers of coverage. With tiers 1 and 2, that's going to be your generic medications. Some of them offer a tier 6 that's also generic. Tier 3 and 4 is going to be brand name medications. Examples of tier 3 would be like Eliquis or Jardiance or Wegovy or Ozempic or something like that. And then tier 5 would be if you're on a more expensive specialty medication. With Medicare for prescriptions, the government started something new this year, and it just went into effect July 1. It's called the Medicare GLP-1 Bridge Program. So if you're on Medicare and You don't have to be on, to get a standalone prescription drug plan, you don't have to be on Medicare A and B. You can simply be on Medicare Part A and get a standalone prescription drug plan, even if you're still working. You'd want to check with your employer. But I highlight this because if you have employer coverage and you wanted to take Zepbound or Wegovy for weight loss, typically your employer coverage is not going to cover that. The government started this bridge program where if you qualify, you can get Zepbound or Wegovy for $50 a month, which is an incredible savings. It is based on weight, so to qualify your body mass, you need to have a body mass index of 35 or higher. But if you're in that category and you wanted to take Zepbound or Wegovy for weight loss, this bridge program is going to cover that. You would need to have at least Medicare Part A and a standalone prescription drug plan to qualify for that. Yeah, if you delay Medicare, you don't have to have that if you have an employer plan. There's also something new that the government started last year, and that's called the Medicare Prescription Payment Program. I have clients who they're on some very expensive medications, and they can hit their maximum out of pocket by February. And this year the maximum out of pocket is $2,100. Next year it goes up to $2,400. But for some people who are retired, coming up with that amount of money in the first few months of every year can be almost prohibitive for some folks. So if you choose to sign up for the Medicare Prescription Payment Program, there's no cost to join. It's offered through your insurance carrier. And what they do is they spread out your prescription costs. Instead of getting hit hard in the first couple months, they spread it out over 12 months. If you sign up for the program, when you go to the pharmacy, you don't pay anything for your prescriptions at the pharmacy. Your insurance carrier will bill you each month for your prescriptions. So just letting you know that's an option. Only about 10% of people are using that option, which hopefully is a good thing, but for those people who are struggling financially, it's an option that's available. The different Medicare enrollment periods. The first one is called the initial coverage enrollment period, and this is based around your 65th birthday. So when your 65th birthday approaches, if you want to sign up for Medicare at that point, you can start the process 3 months before the month of your 65th birth date, the month of, or 3 months following. So you have a 7-month window in which you can sign up for Medicare based around your 65th birth date. If you're going to continue working, or your spouse is going to continue working, and you're going to stay on that employer plan, as long as the employer has 20 or more employees and it's considered creditable coverage, and the Mayo's health coverage, if you're on that, meets that criteria, you can delay enrolling in Medicare Part A or Part B. A lot of people will enroll in Medicare Part A because you aren't going to pay a monthly premium for that. However, if you're contributing if you have a high deductible plan where you're contributing to a health savings account, if you sign up for Medicare Part A, you can no longer contribute to the health savings account. If you're not doing that, it makes sense to go ahead and sign up for Medicare Part A if you or your spouse are going to continue working beyond the age of 65. If you do continue working, the next enrollment period is called the special election period, and this is it's for a lot of things, but for folks who have worked beyond the age of 65 and they didn't sign up for Part B yet, this is the election period that allows you to do that. You would want to start that 2 to 3 months before you're ready to retire to sign up for Medicare Part B and or Part A if you didn't do that already. Once you do retire and leave your employer plan, you do have 8 months time once you leave your employer plan to sign up for something, but you probably don't want to go without coverage for 8 months. So if you start the process 2 to 3 months before, you're going to leave employer coverage, everything will work seamlessly to where you aren't going to be without coverage. If you're going to sign up for a Medicare Advantage plan, you have 63 days to sign up for something after leaving employer coverage. Any questions on that?
So you sign up 2 months before you leave, then
Yeah.
you don't have to pay for it right away, but you just pick it up as you need it.
Yeah, so if you're beyond the age of 65, once you sign up for Medicare Part A, you won't be paying a premium, but Part B, If you apply for Part B beyond the age of 65, you can let them know that it'll always start the first day of a month. You can let them know what month you want that to begin, so that you're not paying for it before you need it.
Other than that, I haven't signed up for the second part yet.
Yeah, so if you haven't signed up for Part B, yeah, as long as you're working and on an employer plan, you can delay that. So you made the right decision there.
So just once I have a kind of a timeline, just let them know, and there's
Yeah.
a 2-month window to jump on.
Yeah, and we can help you with that too. There's forms I'm going to show you in just a minute here that you'll need from your employer if you do that. Once you are on Medicare, every year there's what's called the annual election period that runs from October 15th through December 7th. And this is the time frame in which you can review if you have a standalone prescription drug plan. You can review if that coverage is still going to work for you the following year, or you can switch to another plan. If you have Medicare Advantage, you can see if that plan is still going to work for you for the next year. If it doesn't, we will recommend a plan that's going to work for you for the next year. And then the other enrollment period is for people who are on Medicare Advantage plans. The government added this about 5 years ago. It's called the Medicare Advantage Open Enrollment Period. Every year from January 1 through March 31st. If you don't like your Advantage plan, if you have an Advantage plan and you don't like it for whatever reason, you have one more opportunity to switch either to another Advantage plan or to drop it altogether. Any questions on that? Okay. So delaying Medicare benefits. We can help you compare your costs of your current employer plan versus what it would cost you to be on Medicare. For most of them, if you're a male employee, most of the male people I've met with, it makes sense for you to stay on the male plan if you're going to work beyond the age of 65 until you're ready to retire. Male coverage is deemed creditable by Medicare, and obviously they have more than 20 employees. Again, if you apply for Medicare Part A, don't do that if you're on a high deductible plan where you're contributing to an HSA. If that's not you, it makes sense to go ahead and sign up for Medicare Part A at age 65. When you are ready to retire, if you're contributing to an HSA account, you want to stop doing that 6 months before you're going to go on to Medicare. You can apply for Medicare Part A and or Part B online at the Social Security website. It's ssa.gov. If you've ever created an account for yourself on Social Security, you can log into that and do it too. We can help you with that too. And again, there's a never cost for our services. Or you can go to the Social Security office and do it. There is, once you do apply for Medicare Part B, if you're beyond the age of 65, there's a form you'll need to get from your employer verifying you've had insurance with them since age 65. And it's called the Request for Employment Information. You fill out Section A, the employer fills out Section B, and they're just telling Social Security that yes, you've been covered or your spouse has been covered since age 65. And this form, once they fill it out and sign it, this gets submitted at the same time you apply for Medicare Part B, and this prevents being charged any penalties for not signing up for Part B at age 65. I get questions all the time. So, well, I was told I have to sign up at age 65 even if I'm still working. That's not true. You can delay it. And if you do delay it, this is the form that prevents those penalties when you do apply for it. Any questions there? Okay. There are income impacts, especially when you retire, but there's something that's called extra help that's available. And maybe it's not for you, but I meet too many people who they're approaching 80 years old and they never knew this was an option and they can barely afford their Medicare premium. But if you qualify for extra help, you'll see across the top there's percentages. That's the percentage of the federal poverty guidelines for this year. And based on your family size, if your income is below these levels, you're most likely going to qualify for some sort of extra help. If you qualify for extra help, it can help lower the cost or eliminate the cost of that Part B premium of $202, and it's going to lower the cost of your Part D prescription drugs. So if you know of someone, it may not be you, but if someone who's really struggling financially and they're on Medicare and they've never applied for extra help, they should apply for extra help. You can do it through Social Security, or they can contact their county Department of Human Services, and they will help them apply for it too. The other side of that coin is if you're in the high income category. There's something called the income-related monthly adjustment amount. Every year, Social Security works with the IRS once you're on Medicare, and they're going to take a look at your tax returns from 2 years ago. So this year, if you were going on to Medicare Part B, Social Security and the IRS are going to look at your modified adjusted gross income from 2 years ago, from 2024, and if your income is over these thresholds, you're going to be assessed a surcharge on your Part B premium and your Part D premium. So if you file your taxes individually and your modified adjusted gross from 2 years ago was over $109,000, the Social Security is going to add on a surcharge to your Part B premium. If you're married filing jointly and your income was over $218,000, again that's modified adjusted gross income, your Part B premium is going to go up. So you can see in this third column here where it says Part B premium, if you're married and your income was $250,000 from 2 years ago, your modified adjusted gross, your Part B premium is going to go from $202 up to $284. And that's going to be every month for the rest of the year, and then every year it gets reevaluated. If it ever comes to a point where your income drops below that, then you no longer pay the surcharge. So the higher your income, if you're married and your income was over $750,000, you're going to pay almost $700 a month for your Part B premium. And then they're going to add on $91 a month for your prescription drugs. So there are exceptions to this. Social Security will let you know if you're going to fall into this category, if they're going to assess a surcharge. If it was, you have the option to appeal their decision. But if your income was inflated 2 years ago, maybe because you inherited something or you sold a house or property or something, if it's a one-time event like that, it's worthwhile to file an appeal because generally they'll grant that appeal. If it's just based on regular income, you can file an appeal, but they're probably not going to approve it. Any questions? Okay. So premium costs. We know with Medicare Part A, you aren't going to pay a monthly premium if you've been working in the U.S. or your spouse has for at least 10 years. This year, Part B premium is $202.90 for most people. That typically gets announced in November if that premium is going to stay the same, if it goes up or goes down. It's only, I think, gone down 1 year in 18 years that I can remember, but it's a possibility. If you go with Medicare Advantage plans, there are plans that start at $0 a month and they can go up to well over $100 a month. And so when you add up your costs, that gives you an idea if you go Advantage. If you go Medigap supplement plans, there are high deductible plans that start around $75. And if you go with a plan where you don't have any co-pays after a small deductible, those are going to be well over $300 a month. If you're a smoker, it doesn't matter with Advantage plans, it does matter with Medigap plans. If you're a smoker or tobacco user, your rates are going to be even higher. And again, those rates are just for your medical coverage. If you go with a Medigap plan, you're going to want to add on a Part D prescription drug plan, and those run anywhere from $5 a month to over $100 a month. And again, we review that for you so that you know whatever medications you're on, we're going to help you choose a plan that's going to give you the best coverage. And then also, if you want dental coverage, when you go Medigap, you have to buy a dental policy. And if you want eye coverage, then you have to buy a policy for that. So you can get upwards of $400 a month if you go Medigap versus $100, $150 for Advantage plans. But there are reasons why people go one way or the other. It doesn't matter to me which way you go, but when we sit down and help you talk through it, it really helps, I think, people decide which route they want to go. If you read online, a lot of people talk very negatively about Advantage plans. That's not true in Minnesota, in my opinion. I'm licensed in several states, and there are some states I wouldn't want an Advantage plan, but Minnesota really has the strongest, in my opinion, in the country, in that we have carriers where 97% of providers are in their networks. In some states, you're lucky to find 50% of providers that are in their network. So it's not as huge of an issue in Minnesota as it can be in some other states. But again, it's your choice. Any questions on that? Do we have any questions online? No? Okay. Well, with that, like I said, with those, here's my contact information. If you fill out this, if you're in person and fill this out, I'm going to send you a thank you. I prefer not to call people these days because everybody's so mobile, and I don't want to be calling you when you're driving or standing in line at Target or something. But if you leave an email address, I'll send you a thank you, and then it's up to you if you want to respond. But with that, are there any questions that either you have online or in person that you had coming into the seminar that maybe I didn't answer that you'd like to ask? Yes?
So if you sign up for Part A, Part B, where does D come in? Would a Advantage plan usually offer something like it, or
Yeah.
do you need to separately sign up for D?
That's a good question. So the question is, if you sign up for Medicare Part A and B, where does Part D come in? So if you sign up for a Medicare Advantage plan, you're getting C and D together for that monthly premium. So they automatically combine your prescription drug Part D and the Advantage plan. If you go Medigap plan, then we would also need to get you signed up for a standalone Part D prescription drug plan. But the Advantage plans included all together, the Medigap plans do not. Any other questions? Yes?
Can you just sign up for Medicare without having someone like administer that? You know what I'm saying?
So you can, to sign up for Medicare, so A and B, you sign up through Social Security. And yes, if you're comfortable going online to their website, you can sign up for A and B right on their website. You can go direct to an insurance carrier. If you don't want an agent, you can go direct to an insurance carrier to sign up for either a Medigap plan or an Advantage plan. Your rates are going to be the same. We get paid a commission. That's how we get paid. If you go through us and sign up for a plan, we get paid a commission. If you go straight to the insurance carrier, you won't have an agent, but you can if you want to, but you're going to pay the same price for it. Well, for those of you online, this is my contact information, phone number, email address, and you will be getting contacts this afternoon sent out by the Mayo Credit Union. Yes?
Yeah, we have a question online. Can you repeat the part about moving between states? I will be moving in Minnesota and AZ.
Okay, so if you are based in Minnesota right now, if you sign up for a Medigap plan, when you move to Arizona, you can't just switch your plans without the health questions. So if you get a Medigap plan in Minnesota and move to Arizona at some point, that doesn't automatically qualify you to get a Medigap plan in Arizona, which Arizona's Medigap plans are about half the price of what they are in Minnesota. You would have to go through the underwriting and be asked health questions. If you can answer no to all the health questions, you could switch to a Medigap plan in Arizona. If you start out with a Medicare Advantage plan in Minnesota and you move to any other state, you're going to lose your Medicare Advantage plan. And then if you want to sign up for a Medigap plan in that state, you're going to be able to sign up for it without the underwriting. They're not going to be allowed to ask you health questions because you lost your coverage against your choice. So those are kind of the differences between the Medigap and Advantage plans. Arizona's Advantage plans, the zero premium plans in Arizona are very popular, and they have a lot more HMO plans in Arizona than we do in Minnesota. So those are the kind of things. I work with a lot of people in Arizona. So yeah, if you have questions about that, you can feel free to contact me. Hopefully that answered your question. If not, let us know.
Why does it vary so much from state to state? Just government regulations or insurance carriers?
Insurance carriers, we're fortunate in Minnesota to have nonprofits like Blue Cross, Medica, and Health Partners. And they are less driven by profit than obviously than the United Healthcares and the Humanas and those. They're also less likely to deny claims. They may, but they're less likely to deny claims and they're quicker at prior authorization requests. In Arizona, it's going to be, well, they do have nonprofits in there, or other states, they have nonprofits, but the for-profits are more likely to deny claims and they're there to make a profit. So I've gotten to the point to where I've had too many complaints about some of the for-profits, so I don't sign up. I recommend people not go with those, but that's not always true. So good questions. Yeah, so if there are no more, oh, go ahead.
In Minnesota, what would you say the percentages are versus the three options?
Well, in the metro area, probably 90% of people I work with go Medicare Advantage. They have lower pricing in the metro and just more options. Down here, especially in Olmsted County, this year Blue Cross is only offering one Advantage plan in Olmsted. I think Medica has two, so I have more people down in this area who go Medigap, but not everybody. There are some counties that have what's called Medicare cost plans too. And if you're in that county, we would talk to you about that. They're kind of a hybrid between Advantage and Medigap. But plans in southern Minnesota are the highest priced of anywhere in Minnesota, just because if you want to be in the Mayo network, if they agree to have you in their network, you're going to pay the Mayo more money than you would possibly some other providers. But there's value to be in the Mayo network. Okay. Well, if you do have questions, feel free to reach out. I will be here afterwards. If you fill out that form, leave it with me, and like I said, I'll send you a thank you email. You're not required to fill it out, but thank you for attending, and I'm here to answer any questions if you have them. Thanks.